Let's learn about a small topic in nose and most commonly asked in all competitive exams, that is rhinoscleroma or hebra nose, which is a systemic manifestations in the nose or the granulomatous disease of a nose. The causative organism for this rhinoscleroma is the Klebsiella rhinoscleromatis. From the name of the disease, we can came to the organism which is Klebsiella rhinoscleromatis, which is also called the fish bacillus. This bacillus is a gram-negative rod which is immobile and it is a capsulated organism. And it is this rhinoscleroma disease is also called Hebra nose because this rhinoscleroma is coined by the person von Hebra in the year 1870. This rhinoscleroma disease is an endemic disease prevalent in the particular group or in a population, and in India it is more common in northern part than the southern part. There is no age or gender predisposition in case of rhinoscleroma or Hebra nose. In this disease, we have 4 stages. First stage is catarrhal stage, which is also called the foul smelling discharge stage. The patient will be complaining of profuse bilateral foul smelling nasal discharge, which will be lasting for weeks to months, which is followed by the atrophic change or atrophic stage. In this stage, the nose will be having multiple crustings which resemble the atrophic rhinitis. And the third stage is the granulomatous stage. Here, multiple nodules is coalesced to form a single nodule, and this gives a woody feel over the nose. These are mostly painless nodules. The fourth stage is the cicatricial stage, which is nothing but scarring stage. In this stage, at the last, there will be having fibrosis and adhesions. Because of the fibrosis and adhesions, there will be narrowing of nasal airway and there will be stenosis of nose and respiratory compromise will be there. This Klebsiella scleromatis affects the upper respiratory tract and lower respiratory tract of the person, starting from the nose, nasopharynx, oropharynx, and laryngopharynx. It goes up to the trachea and subglottic area. If the subglottic area is involved, at last it may lead to the cicatricial stage and there will be a narrowing of the subglottis which leads to the respiratory discomfort of the patient. To diagnose this rhinoscleroma or Hebra nose, histopathology plays a major role and it gives us 2 specific cells. One is Miculous cells and other is Russell's bodies. Miculous cells are almost diagnostic. If we see a Miculous cell, then it will be mostly diagnosed as rhinoscleroma. Miculous cell is nothing but the large foamy histocytes. As this rhinoscleroma is the granulomatous disease of nose, there will be infiltration of a different kind of inflammatory cells. All the inflammatory cells, including lymphocytes, plasma cells, and eosinophils, and histocytes is also infiltrated. These histocytes forms a large foamy cells or there is with the central cytoplasm, and this typical cell is called the Miculous cells. These are vacuolated Miculous cells with the center nucleus. In some condition or in some persons, this Miculous cells also shows the organism, causative organism, that is Klebsiella rhinoscleromatis can be seen in the cytoplasm of this Miculous cells. And at the epithelium, there is a normal epithelium, respiratory epithelium, and we could see this metaplasia squamous metaplasia because of this organism. And coming to the result bodies, which is nothing but a inclusion body because of the plasma cells which produce immunoglobulins, and this accumulation of immunoglobulins forms this inclusion bodies and genus eosinophilic inclusion bodies. Culture of the organism may also be helpful. Coming to the treatment, we have medical management and surgical management. In medical management, the antibiotic of choice is streptomycin 1 gram per day and tetracycline with tetracycline 2 gram per day. It should be given for 4 to 6 weeks or until there should be a negative culture for 2 episodes will be there. We can use steroids or without steroids. The use of steroids in case of rhinoscleromatous as it reduces the sclerosis or fibrosis, and surgical treatment can be given for the patient if they are having the nasal deformity. To correct the nasal deformity, surgery can be done, and to maintain the airway, surgery can be done. In some studies, they also use this elastic stent to maintain the nasal airway. And radiotherapy is of no use in case of rhinoscleroma. This is a clinical picture showing rhinoscleroma involving the nose and the upper lip. There is a multiple nodules which coalesce to form the nodules, and which will be mostly painless, and there is atrophic changes is there and scarring fibrosis is there. So there is a airway obstruction is there and airway gets compromised in this clinical picture.